Did you know Sjögren syndrome is not just dry eyes and dry mouth? What if I told you this condition can affect your teeth, nerves, lungs, skin, digestion, energy levels, and even the way your heart rate behaves when you stand up? Sjögren's is an autoimmune disease where the immune system mistakenly attacks the body's moisture-producing glands. But here's what many people don't realize. In some patients, the symptoms go far beyond dryness. And that is why Sjögren's is so often missed. Many people spend years being told they're stressed, dehydrated, anxious, hormonal, aging, or simply run down before anyone connect the dots. Before we begin, a quick introduction. I'm Nurse Ray, a registered nurse with more than 20 years of experience caring for patients with complex neurological and autoimmune conditions. Over the years, I've looked after many people whose symptoms were dismissed, misunderstood, or attributed to stress, aging, or other health issues before the real cause was finally identified. That's one reason I wanted to make this video. Today, we're uncovering 8 surprising signs of Sjögren syndrome that many people overlook. And a few may shock you because they don't seem related to an autoimmune disease at all. Now, let's start with sign 1. 1. Waking up with your tongue stuck to your mouth. This is not just ordinary thirst. Many people with Sjögren's describe waking up feeling like their tongue is glued to the roof of their mouth. Some say their mouth feels like cotton. Others feel like they need water just to speak, chew, or swallow. This happens because Sjögren's can reduce saliva production. And saliva is not just mouth water. It protects your teeth, helps you swallow, controls bacteria, supports taste, and keeps the tissues inside your mouth healthy. When saliva drops, simple things suddenly become difficult. Crackers feel impossible to eat without water. Bread feels like paste. Talking for a long time becomes uncomfortable. You may start carrying water everywhere, even to bed. The shocking part is that many people do not recognize this as an autoimmune sign. They blame coffee, medications, stress, dehydration, or sleeping with their mouth open. But if your mouth feels painfully dry even when you're drinking enough fluids, especially with dry eyes, dental problems, fatigue, or joint pain, it may be worth asking your doctor about Sjögren's. 2. Getting cavities even though you brush your teeth. This one surprises many people. Sjögren's can cause sudden dental problems in people who have always taken good care of their teeth. You may brush twice a day. You may floss. You may avoid too much sugar. But suddenly, you're getting cavities, gum irritation, mouth infections, or needing dental work more often than usual. Why? Because saliva protects your teeth. It washes away food particles, neutralizes acid, and helps control harmful bacteria. When saliva becomes too low, your teeth lose one of their most important defense systems. This can lead to tooth decay, gum disease, mouth sores, oral thrush, burning sensations, and bad breath. Some patients only realize something is wrong after repeated dental issues that do not match their hygiene habits. So if your dentist keeps finding new cavities and you also have dry mouth, dry eyes, fatigue, or swollen glands, your mouth may not be the real problem. Your immune system may be. 3. Food getting stuck in your throat. Sjögren's makes swallowing feel strange. Not always dramatic. Not always painful. Sometimes it feels like food moves slowly. Sometimes dry food gets stuck. Sometimes you need water with every bite. Sometimes tablets feel like they're sitting in your throat. This can happen because the mouth and throat are too dry to move food smoothly. But Sjögren's can also be linked with reflux, throat irritation, and digestive motility problems. That means the issue may not just be not enough water. It may be that the body's normal lubrication and movement systems are not working properly. Many people ignore this sign because it comes and goes. They think, I just ate too fast. That bread was too dry. I probably need to chew better. But if swallowing difficulty keeps returning, especially with dry mouth, coughing, hoarseness, reflux, or a constant dry throat, it deserves medical attention. 4. Burning mouth or a strange metallic taste. This is one of the symptoms patients often describe as hard to explain. The tongue may burn. The mouth may sting. Food may taste different. Some people notice a bitter, sour, salty, or metallic taste that does not go away. This can be very frustrating because the mouth may look normal from the outside, but inside, Sjögren's can change the oral environment. Less saliva can irritate the tissues, increase yeast infections, change taste perception, and make the tongue feel sore or raw. Some people describe it like they burn their tongue on hot tea, except it keeps happening without a clear cause. Others say food does not taste the same anymore. This matters because taste changes and burning sensations are often dismissed as reflux, anxiety, menopause, vitamin deficiency, or dental irritation. And yes, those things can also cause similar symptoms. But when burning mouth appears together with dryness, fatigue, dental decay, or swollen glands, Sjögren should be part of the conversation. 5. Dry coughing that never turns into a cold. A dry cough can be easy to ignore. You think it is allergies, dust, whether that a lingering virus, maybe reflux, but Sjögren's can dry out the nose, throat, airways, and sometimes affect the lungs. This can cause a cough that feels irritating, but does not produce much mucus. Some people also notice a dry throat, hoarse voice, frequent throat clearing, or nosebleeds. The cough may be worse at night, worse in air conditioning, worse when talking, worse in dry weather. The shocking part is that some people with Sjögren's can also develop lung involvement, including inflammation or scarring in the lung tissue. That does not mean every dry cough is dangerous. But if you have a persistent dry cough, shortness of breath, chest tightness, or repeated respiratory infections, especially alongside dryness and fatigue, it should not be brushed off. 6. Tingling, burning, or electric shocks in your hands and feet. Sjögren can affect the nervous system. This is one of the reasons some patients feel symptoms that seem unrelated to dryness. You may feel pins and needles, burning feet, numb fingers, electric shock sensations, a crawling feeling under the skin, weakness or strange pain that moves around. This can happen when Sjögren's affects peripheral nerves. Some people experience nerve symptoms years before they are diagnosed. They may be tested for diabetes, vitamin deficiencies, spinal issues, anxiety, or other neurological conditions before Sjögren's is considered. The confusing part is that these symptoms can be invisible. You may look fine, your skin may look normal, but your nerves may feel like they are misfiring. If tingling or burning keeps returning, especially with dry eyes, dry mouth, joint pain, or overwhelming fatigue, it may be worth asking whether an autoimmune condition could be involved. 7. Feeling dizzy, shaky, or exhausted when you stand up. This is one of the most unexpected signs. Some people with Sjögren's experience autonomic dysfunction, sometimes called dysautonomia. The autonomic nervous system controls things your body does automatically, like heart rate, blood pressure, sweating, digestion, and temperature regulation. When this system is affected, standing up can feel strangely difficult. You may feel dizzy, lightheaded, shaky, short of breath. Your heart may race. You may feel like you need to sit down. You may feel wiped out after basic activities. Some people describe it as feeling flu-like, or drained after standing, showering, shopping, or walking around. This can be mistaken for anxiety, poor fitness, low iron, dehydration, or stress. And sometimes those things are involved. But when these symptoms appear with dryness, brain fog, fatigue, nerve pain, or autoimmune features, Sjögren's may be part of the bigger picture. 8. Swollen cheeks or glands under the jaw. This sign can be very strange. Some people with Sjögren's notice swelling near the jaw, under the chin, or in front of the ears. These are areas where the salivary glands sit. The swelling may come and go. You may notice it during a flare after eating or when the mouth is especially dry. Because Sjögren's targets moisture-producing glands, the salivary glands can become inflamed, painful, or enlarged. Many people mistake this for dental infection, mumps, allergies, or a random swollen gland. But persistent or repeated gland swelling should always be checked. This is especially important because people with Sjögren's have a higher risk of lymphoma compared with the general population. That does not mean gland swelling equals cancer. Most cases will not be lymphoma, but new, persistent, painless, or unexplained lymph node or salivary gland swelling should never be ignored. So let's recap. Sjögren syndrome is not just dry eyes and dry mouth. It can show up as a tongue stuck to the roof of your mouth, unexpected cavities, food getting stuck, burning mouth, a dry cough, nerve pain, dizziness when standing, and swollen salivary glands. The reason this condition is missed so often is because the symptoms can look random. A dental problem here, a cough there, fatigue, brain fog. But when these signs start appearing together, they may not be random at all. They may be your immune system trying to tell you something. If this video helped you, please like this video and subscribe for more simple, evidence-based health videos. And comment below, which of these 8 signs surprised you the most?